Victoria's recorded its worst day of the pandemic with 288 new cases. Live to Patrick Murrell in Melbourne. Pat, the Premier's warned the situation will get worse before it gets better.
That's right, Annalise. 288 cases in Victoria. Its worst day of the pandemic. And not only that, it's also taken the unenviable record of the single biggest increase of any state in Australia since the start of the pandemic. That was previously held by New South Wales a few months ago. 212 cases there at the height of the pandemic then in that state. Now, of these cases, that's pushed the number of active cases in Victoria over 1,000 to 1,172. 47 of those are currently in hospital, quite a big increase there, 12 in intensive care. The Chief Health Officer says he expects those numbers to grow by the day and unfortunately, inevitably, there will be deaths from that. 26 of the new cases are linked to known outbreaks. The remaining 262 still under investigation, and we know that could mean community transmission. Speaking of community transmission, 3 suburbs, Craigieburn, Roxburgh Park and Truganina, have seen a significant number of community transmissions over the past 24 hours compared to the rest of the state. That is a particular concern for authorities, who have warned that the triple-figure increases will continue for at least the next week before the numbers plateau and the effect of the lockdown starts to be shown in the numbers.
Certainly 288 new cases today is a pretty ugly number. We have talked about the fact that we would expect an increase in numbers over time and that there was no room for complacency at any point in time. That's as true today as it's been right up until now.
Now, in light of this uncontrollable community transmission within primarily Greater Melbourne and also the Shire of Mitchell, the state government here has issued some new advice on the use of face masks. That is, if you live in Greater Metropolitan Melbourne or the Shire of Mitchell, there are 2 scenarios where you should be wearing a mask. It's only advice at this point, not a requirement. The first is if you're sick and showing symptoms and going to your GP, a doctor, to get tested, you should be wearing a mask so that you don't spread that to other people at the clinic or your doctor. If you aren't, that's the only reason you should be going out as well if you are showing any of those symptoms. The second reason to be wearing a mask is if you are heading out for essential reasons and you can't physically distance yourself from other people, so maintaining that 1.5 metre distance. Examples given include being on a train, in the back of a taxi, or at a supermarket at a particularly busy time. Then it is advised that you do wear a mask, although at this stage it's not a legal requirement. Now, to help people out with this, because masks are expected to get quite difficult to get a hand on over the next few days, the government is investing in 2 million reusable masks, which will be rolled out later this month, as well as 1 million disposable masks.
Our request is that if you are out in Metropolitan Melbourne or Mitchell Shire for a lawful purpose, and you don't think you're going to be able to maintain that 1.5 metre distance in a cab, in an Uber, on public transport, maybe at the shopping centre if things were quite busy, then we would ask that you wear a mask.
The Premier hasn't ruled out extending Melbourne's current lockdown to outer suburbs or regional areas, including Geelong, if the situation continues to deteriorate there as well. Annalise.
Patrick Murrell, thank you. We'll check in with you again soon.